One thing that we hear about often in the clinic, at least I know I hear, I'm sure you do too, just the itchy ears. Have you had patients who come to you and say, Dr. Whitaker, what can you do? My ears are itchy, or they're on fire, or they just sometimes have a quick dagger, like a quick sharp pain. Like the ear canal you can have some unique feelings in there.
It's a sensitive spot, and yeah, I get asked that almost every day. Why do my ears itch? Mm-hmm. What can I do about my itching ears? We want to talk about it today.
Yeah.
What makes ears itch? Maybe what we can do about it. I'll start with one thing that can maybe make an ear itch, and maybe it's not the most pleasant thing. But sometimes an infection in the ear.
Ooh.
An outer ear infection. Sometimes this is called swimmer's ear. Mm-hmm. Sometimes there can actually be an infection in the ear that makes it really itchy.
Do you want to say the gross word out there for them to hear?
I don't know that I do. I don't know that I know the gross word. Oh, discharge?
Otorrhea.
Oh, yeah.
Otorrhea.
Yeah,
discharge of the ear. Ooh, that's kind of a gross word.
And usually if you've got an outer ear infection, it's pretty obvious. Yeah. It's not the normal just, ooh, my ear itched for a second, I had to scratch it. Yeah, it's draining, it's running, it's maybe smelly.
Usually smells.
Really itchy, like almost intolerably itchy. But hold on, pause just 1 second. We'll get back to our video. Please like the video, subscribe to our channel, turn on the notifications. We really appreciate it. Back to the video.
Let's get back.
That's certainly one reason why someone could have an itchy ear.
Good. You know, another reason besides the outer ear infection is just someone who has naturally dry skin.
More common.
Probably more common. We have individuals who their skin is naturally dry. And so in our scalp, in our nose, these nares, and even in our ear canals, we have these little glands. Two different types of glands. We have a gland that kind of secretes oil, these sebaceous glands, and they're in our scalp. They keep things moist and supple, but some individuals, I don't think their glands are working. And so their ear canal, you look in there, and it's flaky and dry, and sometimes they'll even have a condition, you know, you can kind of see it out here even before you go in, and you can sense that this person just needs a little bit more of those natural oils to replenish that, or to get some lubrication in there, and so that's another reason I think people get itchy ears is they just don't have enough moisture.
It's so dry.
So dry.
And we live in a dry place. We live in southern Utah. Southern Utah is a desert. It's naturally dry, and dry skin is itchy. You know, this conversation is actually one of the rare instances where we say a little bit of earwax might be good. Because also sometimes earwax can be a natural moisturizer, almost like a little lotion in there that can keep it from getting too dry.
Because it's our inclination to say earwax, yucky. Ooh.
Yeah.
But just a little bit is actually the normal, natural state that you should probably try to, maintain like that. If you're over cleaning.
Over cleaning. A lot of people use Q-tips.
Yep, the swab.
Q-tips it's a discussion maybe for a different day, but it can dry out the ear canal.
Well, it's removing some of that natural moisturizer.
Yeah.
The little bit of earwax that should be there. It might be irritating.
Could be irritating.
Kind of roughing it up.
Canals look red a lot when we look in them, and people Q-tip a lot. So
because you go to the dentist and you're like, I better brush my teeth. And people, before they see us, they
better clean my ear.
Yeah.
It's probably not good. And you know what else can over clean the ear? Hydrogen peroxide. Sometimes we recommend it.
Yeah.
Because sometimes people do have so much wax in their ear, an occlusion of wax, that we say, hey, maybe soften that up with a little bit of hydrogen peroxide mixed with water,
but
diluted.
Sometimes they use it straight.
And if you leave it,
it's strong.
It's strong. It'll dry your skin.
And I like that, what you said, dilute it a little, maybe a 50-50 mix, water, 50 part water, 50 part peroxide. That's probably a more comfortable ratio for your very thin skin deep in that ear canal.
So that's probably the most common reason why the ear canal's dry. Or itchy, because it's too dry.
I'll tell you another one. Some of our patients, obviously they come here and they're wearing hearing devices. They're sticking something in their ear. Now remember, the ear canal is not this soft, padded, perfectly straight, perfectly circular type space. It's a space that is bendy, up and down, hills and valleys and turns, and it's going from this soft cartilage to this inner part of the canal becomes bone, and so now you're putting something in your canal, and it's going beyond the cartilage, and it's kind of probably touching some of the skin on bone. And I can imagine that you get a hot spot once in a while where your little device is sitting in there, and it's depressing, and it's creating a nerve reaction, a facial nerve reaction, and after a while, it probably makes you want to itch a little, right?
Does,
just having something in your ear for 8 to 10 to some of our patients go 16 hours a day.
Yeah.
You might get a little itchy ear, right?
Putting a foreign object in your ear can make it itch, potentially. You know, especially the majority of hearing aids that we fit are what we call open fit hearing aids, which means we're not totally plugging the ear, we're not occluding the ear. We're trying to put in just a very small tip that's almost free floating in some ear canals. And you can imagine this little free-floating thing in an ear canal, it can tickle as you talk and chew, and it's wiggling in there. And if you've got a little thing in your ear that's kind of moving around, it could tickle. Man.
You know, fortunately, the majority and the vast majority of our patients who wear hearing devices, they don't have itchy ears as a result of wearing their hearing device. But once in a while, if we're just trying to figure out how do we get the fit just right, sometimes we have to really make a great effort to get the most comfortable tip possible. And sometimes it's trial and error. And while we're going through that trial and error experience, on occasion they'll say, yeah, I've got the itchy ear. And that's an indication for us, oh, maybe we need to work on your fit.
Try something different.
Yeah, let's try something different in there.
And that's a good point. I think itchy ears with hearing aids is most common in the first couple of days. When you first get a hearing aid, you've got to get used to the feel of it. It's like if you get a new ring or a new watch. And
glasses
those,
the pressure
those first couple
points.
days, you really feel it and you notice it. And then after just a couple of days, that usually goes away.
Yeah, kind of acclimate to that foreign object. You've now got a new piece of anatomy, and your body just adapts to it.
Yes.
Exactly.
So what can we do about it? Let's say we've got somebody watching the video today. They're thinking, my ears itch, and they itch regularly. What can I do?
Yeah, I like the idea that we were just kind of talking about this, seeing a professional, go in, have someone look in your canal. Is it the itchy ear because of dry skin? Is it the itchy ear because you do have some type of infection of some sort? Or maybe you have a papule or a little pimple in there that you can't see, but you keep irritating and it keeps manifesting. So having someone, kind of a professional, go in and take a look at the skin, look at the health of your ear canal, look at some of the properties, making sure that the ear canal is supple, it's healthy, it's doing what it should. I think that's step number one, is just, if you have chronic itchy ears, go see an ear specialist, right?
That's
Audiologist
step,
or ear, nose, and throat doctor or something like that.
The second step, maybe, if a professional's looked in your ear, let's say we've looked in an ear, we think, hey, it probably is from maybe over cleaning or an excessively dry ear canal. One thing that I'll sometimes recommend is use of some natural oils.
Yeah.
Talking something maybe like a baby oil or a mineral oil or something like that. If you take a couple little drops of that, put it on maybe a Q-tip.
Swab,
Just apply that gently. Put a little bit of oil in the canal. That can act as a moisturizer.
And you really don't need to go that deep.
Not usually.
Just kind of in the opening, get that going. And I think that's a good idea. Some people will even go down on their side and they have a trusty, someone they live with, they will just put like a little drop in there and it just kind of runs down. And usually just 5 minutes, maybe 5-7 minutes on one side. Let it just kind of seep in there, and I think that can
help. One thought about that, if you're wearing hearing aids and you're using a little bit of oil in your ear to try to moisturize it, I would recommend putting the oil in at night. So that you don't put it in, say, in the morning and then put the hearing aid in right after it. The oil could potentially clog the hearing aid. So I like the idea of doing it at night, letting it absorb, and then by morning you should be able to put in your hearing aids and be good to go. And
if you come to see a specialist, we usually have the types of oils that are created just for this. They're recommended by doctors. They're created for itchy ears. Some of them say ear lotion for the ear canal and things like that. We have those. They're very, very inexpensive. And
some of them are so natural. They say you can eat it. We don't recommend that either. But that's been recommended to me by the company. But I did
see avocado oil as part of the mixture, the concoction. What's
Don't
fun about those, though, is you put them on your hand and you kind of rub it around and you smell it. They usually do smell good.
Tempted?
I'm
tempted to.
You know, I haven't eaten it, but I mean, I look at it, I've heard the presentation, I'm smelling it. It's pretty nice stuff, yeah. But some of you may need that. Do most people need these type of assistive oils and things to kind of help their canal? No, most ear canals that we look at day in and day out have the perfect amount of wax. The anatomy is doing exactly what it should. It's slowly bringing the wax out into the bowl, and when you shower just with your finger and you wash your ear with soap and water with a washcloth, you don't need to go deep, because your ear canal, it's usually, almost all ear canals are on a little bit of an incline, and so gravity and just going through life and walking, there's a natural process of that oil and that wax just kind of slowly coming out into your ear. So for those of you who are chronic ear cleaning, you're like, oh, I gotta get, and maybe you clean it and you see a little bit of orange or brown and you think, oh, I did such a good job today. Just know that your ear is going to naturally clean itself. So try not to be too fanatical about that.
Yes, maybe some things not to do. Should I use my car keys to itch my ear?
What about a paper clip?
Should I use a pencil?
I don't know.
Obviously not. And we see these things regularly. We'll have patients, it's usually their spouse that tells on them.
It's usually men.
It's usually men.
Yes.
He gets his car keys and he goes to work. Yeah. Probably not. Of course, you run the risk of being damaging the skin.
Right.
Anytime you're sticking a car key in there, you could scratch the skin, you could make it bleed, you could open yourself up to infections. So probably not sticking sharp things in your ear. That's probably not the best way to fix it.
Nothing smaller than your elbow, right? Old grandma.
Thanks, Grandma.
Grandma. So, nothing smaller than your elbow. So I think my most common one is the paper clip. I don't know. I get
bobby
the
pin.
Bobby pin.
Pencil.
Yeah. Oh, pencil. So yeah, let's stay away from these things, because you think you're just sticking this straight object into your canal, but most ear canals almost immediately they bend, and so you're hitting up against areas that are pretty sensitive, and let's keep the sharp objects out of
Stick to the oils. Yeah.
Yeah. So that's itchy ears. Okay, everybody, we so appreciate you watching the video today. If you've liked what you've seen, please like it, subscribe to our channel. It means the world to us, but it also means the world to other people who are trying to figure out what's going on with their hearing health. So thank you for watching.